my name's Nicole. As she said, I'm the pediatric dietitian at Central DuPage Hospital, and I just wanted to give you a little bit of introduction about myself. I've been seeing kids for about 15 years for a variety of things: food allergies, childhood obesity, feeding tubes, just to name a thing, practically everything. And a couple of years ago, a couple of neurologists approached me, one being Dr. Roy, another Dr. Sperry at Central DuPage, because there was a need to provide diets for seizures in the western suburbs. I like a challenge, and so I worked with a couple of dietitians, Robin Blackford downtown, which probably a lot of you know, and Beth Zupek in Wisconsin, to help me out get it started. And I will say, in the couple of years that I've been helping families with these diets, it's been very interesting as a dietitian. It takes a while to get used to providing 90% fat. But I did get past that, and I can say it's been very rewarding to help these families. Quality of life has been amazing. So I'm definitely going to continue and hope that our program grows. So I'm going to kind of talk about my experience the past couple of years with these families and just give you a little bit of what it's like to kind of go through the hospital program with the ketogenic and then touch on some of the other diets too. So as you know, ketogenic diet, very high in fat, about 90%, very minimal carbohydrates. And the ratio, which we talk a lot about, is the fat compared to the protein plus the carbohydrates. And all food for the ketogenic diet does have to be weighed on a gram scale. This slide I like to show just to remind you of those three fuels that our body needs. Kind of basic, just to remind you, of course, the carbohydrate and the protein is going to use that glucose. And that's what we want to do with the fat. We want to end up using the ketones as our primary energy with the ketogenic diet. And again, to look at the ratios, that 4-to-1 being the highest ratio, the most strict, is going to have the most fat compared to your protein and carbohydrates. And then when you get down to the 3-to-1, 2-to-1, and 1-to-1, it's a little bit more liberal, a little bit more carbohydrates, and a little bit easier to follow for the most part. And the 1-to-1 ratio, somewhere between 1-to-1 and 2-to-1, is where I would put somebody for the modified Atkins diet. So what is a typical ketogenic day? This would be for a younger child, maybe 4 or 5 years. We would do some scrambled eggs, maybe a little bit of orange slices, which is going to be your carbohydrate, but we still definitely provide the fruit and vegetables, and then heavy whipping cream. And just to show you, this is the cream that you would use to actually make whipped cream, but of course we're not going to add sugar. And some kids do very well. This actually becomes their milk. Hard to believe for some people, but some kids drink it down no problem. We can add some sweeteners, but it does have to be carbohydrate-free. This is a stevia, and they're a little bit harder to find because some of the sugar-free sweeteners that you would think of, NutraSweet, Equal, they do have carbohydrates. So we have to kind of search the stores and find one that has 0 carbohydrates and 0 calories. So moving on to this child's day, hot dog with mayonnaise, a little bit of watermelon, and then that whipping cream for their milk. And then the dinner, this is a picture here of the ketogenic nuggets, which this recipe I think might be breaded with some sort of almond flour. And then a little bit of carrots, and then the keto ice cream, which is used with the whipping cream, and it's kind of tasty. So another meal here just to show you, and this one has the amount of blueberries you can see there, little bit of lettuce, which there are a couple free foods on the diet, lettuce being almost free, so that's good. And then the avocado, which I really like for the diet, I call it the perfect ketogenic food. It has to be the Hass avocado. There's 2 kinds out there in the stores. It's almost a 4-to-1 ratio, so these kids hopefully they like avocados, they can eat, they can eat almost as many as they want to, and then a little bit of mayonnaise for that. The tricky part, as you know, if you have kids, is that We can't force them to eat. Sometimes they're picky. So at first, it takes a little while to find some meals that they like. And, if they're really picky, that can be an issue because it's going to be a struggle to find some meals that they will take. This one I like a lot. It's a ketogenic cereal using a lot of nuts and coconut, and some of my kids will use the almond milk in this, so it actually is kind of like a real cereal. This is the Keto Mac-n-Cheese. This one uses the shirataki noodles, which I believe they're made from a root, and I'm not even going to try to pronounce the root, but it's a dietary fiber, so it's very, very little carbohydrates, and a whole lot of cheese in there too, and butter. This one, the Ketogenic Pancakes, there's a few recipes out there for keto pancakes. A lot of them do use nuts. I have a family who, she's just a baby right now, but she's allergic to nuts. So we're definitely going to have some challenges because a lot of the recipes do involve some nuts, but we'll figure it out. So as far as being admitted for the diet, the family usually comes in after the neurologist decides we're going to try the diet. Family comes in to talk to me. I'll kind of explain, again, if they're not that familiar, what the diet is. They're going to be in the hospital about 4 or 5 days, and parents don't have to be there the whole time, but it's going to be a lot of education on their part and my part. So we'll work out a schedule so that they are there for most of the day. And one thing I remind them is that this diet, it is restricted in calories a little bit. So the meals, the portions are small, and just kind of be prepared for that. We are going to have to use some vitamins and minerals. We can become pretty creative with that. Sometimes we crush them. Sometimes we can mix them in their sugar-free drinks or their cream. We usually figure out a way, or there's powder vitamins out there too. So we can usually figure that out. And these kids are kind of used to taking medicines anyway, so that's not too big of a problem. We talk about, some of the issues that may arise. Dr. Roy did mention the constipation I do see in most of my kids. We really just try to get some of those fluids in there. Speaking of fluids, another thing with the sugar-free beverages, some, even though they're sugar-free, do have carbohydrates. So again, we have to find some. I have a bunch that I try. This is just like a flavored water. Some kids will just drink water. Some kids will not. One that I know some of the older kids like is the Gatorade version. The Powerade Zero does not have any carbohydrates. But you have to be careful of that because things like Crystal Light do have some carbohydrates. And they can be okay on the modified Atkins, some of the other liberal diets, but not for ketogenic. It has to be 0 carbohydrates. I do have a little girl who does not like to drink water. And we did, when she came into the hospital, we did have to put her on an IV. Most of the time we don't because they're fine with drinking. But if they're not going to drink the water, we might have to do that initially. What to bring to the hospital. I tell families to bring the plates, the sippy cups, the silverware that they're used to. Movies, they're going to be there a few days, so, stuffed animals, whatever's going to make them most comfortable, and especially those plates and cups because we want them to kind of feel like they're eating like they do at home as much as we can. And we do have a child life specialist that's great that can help to create some activities for the kids. And food preferences. That's another thing we go over. I have a list of foods, things like, does your child, will she eat mayonnaise? Is she okay with adding butter to foods? And go through the fruits and vegetables and just see if there's, avocado. Does she like that? So that if a child is so picky, I may know right away, wow, I'm not sure this diet's going to work, but, we can try, but hopefully they're not too picky. So another thing that I always remind the families, and this is probably the hardest part for me, is the time where they are going to be not starved, but we are going to go 12, 24 hours without eating. In the hospital, they refer to it as nothing by mouth. And like Dr. Roy said, there are some studies out there. There are some facilities that actually kind of eliminate this fasting, and they do go right to the diet. They do more of a gradual introduction of the diet. The neurologists that I work with at the hospital, they do like to fast. Again, this is the hardest part for me. I do not like starving children. But I know the end result. I know it's worth it. So I just warn the parents, we're going to go maybe 24 hours, maybe even a little bit longer, because the doctors really like to see that ketosis getting started. And that is the fastest way to, to put them in ketosis is the fasting. So we just try to keep them busy as much as we can during that period. And again, encourage sugar-free fluids. I make sure the parents find something before they come in that is going to work to keep them hydrated so that we don't have to do the IV. But most kids, from my experience, they kind of get used to that IV if we need to do that. And then for home, of course, too, we want them to stay hydrated. If they're drinking, let's say that this does become their milk, it's still a pretty small amount. We might do 3 times a day. It might be maybe, a 6-ounce portion, and we still want them to get some extra hydration. So they can drink those sugar-free fluids anytime they want. The diet used to restrict fluids, but it no longer does. So that's good. That helps with the constipation. And then the scale. I have the families bring their scale in. The Charlie Foundation does have a little kit that you can order your scale ahead of time. I have seen them in office stores. They're a little tricky to find. It has to be a gram scale. And we do have them at the hospital too, but they're a little bit more pricey at the hospital. So when we're going to start the diet, like I said, we fast about 24 hours. And then what I do, there's a couple of different ways to introduce it. I kind of do a gradual introduction with the lower ratio. We'll do a meal or two with the lower ratio. And then we will kind of work up to, usually the kids, I put them on a 3-to-1 ratio. I found that if we start there, if, diet's working, it's a little bit more liberal than going all the way to the 4-to-1. And it does usually work with the kids. If it's working, we start to see more seizures, we might tighten it up, and I might even do like a 3.5 ratio so that we have room to work with. So generally I start the kids on the 3-to-1, and that was something that they were doing at Children's in Chicago, and it seems to work. So things that we look for, we're going to make sure, of course, work with the pharmacist, make sure all the medications do not have any carbohydrates, teach the families about when they do get sick, of course, things like cough syrup, it's going to have sugar, just find alternatives for medications at home, children's Tylenol, that kind of thing. And we're going to look at a lot of labs. I know Dr. Sukalaki mentioned some of the labs. We keep a close eye on them. We don't have the nurses poke and prod a lot, but we do keep an eye on their glucose levels for a while. Just, they're really important labs. And, of course, checking the ketones. We do have the families learn how to do that. If they're still in a diaper, we can work it out. There's ways of, using those strips to get the ketones from the diaper. That's not a problem. And so the nurses will teach the families how to do that. When they go home, they're only needing to check the ketones once, and that's at night. Once a day. And then, of course, the blood sugars, but that's just in the hospital. After the kids go home, they rarely have trouble with low blood sugar. Their body does get used to the diet. Some of the other things we might notice, some of the kids do get a little sick, a little nauseous. Could be because of the fasting, also could be because their bodies are getting used to the diet. And of course, vomiting would be a sign, too, that their ratio was too high. And I would say that I see that more after they've gone home and they call me. Let's say we did get them up to a 4-to-1 ratio and the child is feeling sick and vomiting. We might back off and go back to a 3.5 or 3 ratio because it might be a little bit too high. And their ketones are going to tell us that, too. So we're going to separate the meals from the medication. Sometimes that will help. And another thing that we have to work with is, let's say the child takes, this medication 3 times a day, and they always eat with their medication. What should I do? So what I'll do is I'll work in a small snack at that time so that we still can get that medication in at the normal scheduled time. It's just a lot of trial and error and, working with the families to make everything happen. And then, of course, dehydration. Like I mentioned, we just want them to keep drinking that water or that sugar-free drink, whatever we find that works for them. So usually what I'll do on day one, we'll just kind of get them situated. We'll talk about fluids. We'll talk about checking their ketones. And then the second and third day is a lot of practicing with the scale. I'll have families, bring their scale in, and we'll have some sample meals, and they can actually practice weighing the food and, just as they would at home, which is kind of fun, actually. Troubleshooting, of course, we'll talk about sick days, things that might happen at home, and just some other menu ideas to get them ready to go home. Behavior can become an issue with this diet. I do have a little girl that's been on, I think, 2 years, and she is bored with the diet. We're trying to come up with some new ideas, and actually I have a great cookbook that the father of this child brought me, the keto cookbook, and he's come up with a lot of great recipes for her, which I'm thankful that he brought me that recipe book for some of my other families, but it becomes a challenge. She wants to eat the foods that the other kids eat at school. She's in preschool. He's trying to bake some different things. It becomes a little difficult. So what they've done, actually they did this on their own. Usually when we wean the diet, we do kind of calculate out how we want to do it, especially a kid that's been on it for 2 years. But because of financial reasons, he kind of started doing a sort of like an Atkins diet for her on his own. And it's working. He's just kind of making a lot of meat and a little bit of vegetable. He's doing the best he can with it, and she's still doing well. So she's kind of liberalized herself, and now she can eat a few of the foods that she wanted to eat. Just a general behavior guideline for the younger kids. We kind of want to limit the meal time. We don't want a lot of, whining and carrying on. And we just kind of want to serve the food the best we can, maybe not eating regular food in front of them. That might help. And this is something that does kind of go against something that I've always taught families. It's very important to eat with your child. So you have to find a balance. Some families do sort of an Atkins diet themselves so that they are eating, the same foods, which can be helpful so that the child doesn't feel like they have this, special diet. And then just, be consistent and, let them know that this is important for you, but I'm going to do it with you. One thing that is kind of tricky about the ketogenic diet as well is that ideally they eat all of the food on their plate. And the reason for this is because everything that's been calculated out is that exact diet ratio of fat to carbohydrate and protein. Again, with kids, you can't always make them eat their whole meal. So what I do tell them is the best you can kind of have them eat around the plate, we call it, where they kind of take, a bite of each thing, or the best that you can encourage them to eat the same amount of each food so that they are getting that diet ratio. But the best way, and I'll show you this we do pass these out. This is a little spatula that we give to the kids. They like it because there's all different colors they can pick from. And the ideal situation with a ketogenic diet is they do eat everything, so much so that they scrape the plate so that they get that exact diet ratio. Again, difficult with kids, but it's smaller amounts. They are hungry, so if they like the food enough, usually they will eat all of the food. But if they're not eating that meal, we can't force them to eat, so we just try to encourage them to eat the same amounts of each of the foods. If it starts to become a problem, we'll take that meal out of their menu and try to create some different ones. So as far as discharge for the ketogenic diet, we want them to be comfortable eating their meals, of course, no vomiting, they're feeling good, healthy. Usually the kids become a lot more active after they start. First couple of days, they're pretty lethargic, just partially because we're fasting them, but their body is also getting used to it. So we notice a change after a few meals for sure, and we want to work up to that full strength, the diet ratio that we prescribed for them, and of course that their blood sugars are back to normal. We don't usually have a huge problem with the blood sugars, but we will check them throughout the whole hospital stay. And then the neurologist is asking me, how's the family doing? That's a big part of it. Do they feel comfortable? Are they ready to go? We've had families go through the whole program in 3 days, and then they're ready and they go. We've also had families, it's 5 days. It just takes a little bit longer so that they're used to the scale and they feel comfortable with enough menus to go home with. So I thought it would be interesting to you just to talk about some of my patients. As far as I kind of looked at the past year, and 4 of my patients, significant seizure reduction. It's amazing. I did have one little boy, I think he's 2 now, and his just seizures all throughout the day. And he rarely has one now. I would say the first couple months it was associated with constipation. And we fixed that, I think, with maybe milk of magnesia, and his seizures he's doing really well. So, and the other kids, there's been ups and downs. One little girl gets sick a lot. She just has a lot of upper respiratory infections, and whenever she does, she has seizures. So we don't really do anything different with the diet. Mom calls me every time, and we just talk about encouraging fluids. They can do things like, Jell-O and broth when they're sick, different things like that. So there are some ups and downs, and the neurologist will adjust the medication if needed. Diet, we might have to change too. We've changed ratios a little bit as well. One of my families, we did wean off the diet. We did not see improvement. Her seizures actually got worse. I'm not sure why, but I think that we went 3 months and we did wean her off the diet. And then I did have a family that dropped out. It was just the diet was too difficult for the family to follow. We had some challenges with her as well. She didn't really drink much water, and that was a concern. And I just put that last one in there. 80% of them call me every week or two, because it's a commitment on their part, on my part. They do call me often with questions, which I don't mind, but it's definitely a huge commitment, and they have to be very motivated. So moving on to the modified Atkins diet, very low carb. I know Dr. Roy got into that quite a bit. And like I said, it is similar to the 1-to-1 ratio, a little bit more liberal, encourages fat, and does not limit protein. And we can do that as outpatient. Education on my part includes carbohydrate counting, similar to how I would educate somebody with diabetes, except it's a lot less, of course, carbohydrates. There's a couple different ways to introduce it. What I've seen is you start with 10 to 20 grams a day, and you move up to around 30 grams a day. It's going to be a little bit different depending on the size of the child. But this is very, very limiting in carbohydrates, but there's a lot more recipes that you can use out there. And a lot of cookbooks, and you can still use the ketogenic recipes and just modify them a little bit. What I found is kind of nice is you can use a ketogenic recipe and then add some fruit to get a little bit more fruit in there, which is nice because it's the keto is so limiting in fruit. So this is a typical modified Atkins meal. This is a fish with cream sauce with some salad, which I think looks delicious. There are a lot of different things you can do with that modified Atkins, more so than the ketogenic. And then the low glycemic index treatment, which Dr. Roy did touch on as well. And the goal is going to be a lot higher in grams of carbohydrate. It's around 40 to 60, again, depending on the size of the person. And that you're going to be using the foods with the low glycemic index. One thing that's a little bit different is that with this diet, you want to make sure that you spread those carbohydrates evenly throughout the day. That's something that you have to pay a little bit more close attention to. And the idea is to balance your carbs with that protein and fat and to maintain those consistent blood glucose levels. We do still need to add vitamins with this diet. From what I've seen, a lot of times the calcium, vitamin D are the ones that I'm really concerned about. There's others, but this one stands out because we're not doing a lot of milk, we're not doing a lot of dairy. And those are pretty easy to add into your diet. So here's just a couple of examples of options for low glycemic foods, just to give you an idea. The numbers there being their glycemic index. You're going to want to choose something like rye bread over white bread, cherries over pineapple, cauliflower over corn, and there's a lot of lists out there, but you're going to kind of go on those numbers to choose the foods with the lower glycemic index. So it's a lot of dietary counseling as well, just to get used to knowing which foods you can and can't have. And this chart I put in here to give you kind of an idea, especially to focus on the grams of carbohydrate. If you go all the way to the right, the standard healthy diet, which would also be recommended for a diabetic diet, 225 grams a day. And this is, I based this on a typical 12-year-old child. It's not going to be that different for an adult. Depending, let's say an adult male, it might be closer to 300 grams of carbohydrate a day would be a healthy diet. So if you're comparing it to low glycemic, 40 to 60, big decrease, modified Atkins, 20 to 30, and then, of course, our ketogenic is almost no carbohydrates, 5 to 10 grams. So you can see where the restriction levels are. And then again, it's kind of interesting to me to look at the fat, where a typical healthy diet, you want 30% of your fat to come from, or 30% of your calories to come from fat, whereas low glycemic is 60, modified Atkins 75 to 85, and then classic ketogenic is 90%. So just to kind of give you an idea of where we're at with our fat and our carbohydrates. Some of the challenges, which I have already mentioned, food allergies being a big one, especially those nuts, because a lot of the recipes do use nuts, almond meal, that kind of thing. It can become a challenge. So with that, I do see a lot of kids with food allergies, and what I recommend is they go back to the allergist, because kids can grow out of allergies. Let's make sure, do they really have a dairy allergy? Let's get that out of the way so that we know what foods we can and can't use. Specialty foods can be expensive. It's not going to be as expensive as some medications, but some of these specialty flours, sometimes when we get into the use of the different ketogenic formulas, some of the kids that don't eat quite as well, we might use the Keto Cal, which is a great introduction to the world of the ketogenic diet. We can do a lot with that formula. It can be expensive, but sometimes we can get it reimbursed through insurance. But the flours, those kind of things that you need to get at Whole Foods or specialty stores, they can become expensive. They can add up. And we've tried to get those reimbursed, but it hasn't worked so far because it's food. Kids get bored, like I mentioned. We run out of recipes. We run out of ideas. We just try to mix it up the best that we can. And constipation I see with most of my children, so we just really want to encourage those fluids. And we can correct that with different things like Miralax, milk of magnesia if we need to. Traveling is difficult for families. They have to bring their scale. They have to bring all their foods. They have to bring, formula for using that. It can be tricky. One of my, the one that I mentioned with the cookbook, he has this little suitcase that he carries with her name on it. It's really cute. And he's got it down. He just takes it wherever he goes. And we do have special letters that we can give to the airlines so that you don't have a problem with carrying your sugar-free fluids and, your different foods that you need. So we can get past that part of it. School can be a challenge, especially for the older kids, because they do want to eat like the other kids. And, usually we talk to the office, we talk to the school nurse just so they're aware. And that part is okay. It's more the other kids that becomes a little bit of a challenge. And then, of course, peers with our older kids, teenagers who just want to eat like everybody else. And that's where I think that the modified Atkins can work. I would say that both the child and the parents have to be motivated because, again, it's still very limiting, and we can run out of ideas. So we just have to stay motivated for them. And I just wanted to give credit to the Charlie Foundation one more time because they provide most of my photos, which you're all familiar with. I have a couple other cookbooks up here, and that's it.